So what we're going to go through today is how to calculate somebody's MUST score using the Bapen MUST calculator. MUST stands for the Malnutrition Universal Screening Tool. On the right-hand side of my screen, I've got a weight monitoring chart from the Caring Care Home for the patient Jess Bloggs. Let's have a closer look at her weight history. So in January, that's when she was admitted to Caring Care Home, and relatives report that her weight was stable at 55 kilograms, which is a healthy BMI of 20.2, which is a MUST score of 0. At this point, there's no need for food diaries, no need for closer monitoring, just standard nutrition care. In February, we see a slight drop in her weight, but no immediate cause for concern. Her BMI is still in the healthy range and still an overall MUST score of 0. However, we can see by March she is actually trending downwards and just under 2% weight loss total, meaning her BMI is now slightly underweight, increasing her risk of malnutrition to medium with a MUST score of 1 due to her BMI score. The Caring Care Home implemented MUST Action Plan 1, and we see in April she regained her weight. Her BMI is back in the healthy range, and she continues gaining weight until May. In June, Jess Bloggs had a fall and was admitted to hospital, and during her admission she got a chest infection. Her appetite was affected and she began eating less and losing weight. She was discharged in August at 50 kilos. This puts her BMI in the very underweight range at 18.4 and over 10% weight loss since May. The Caring Care Home then implemented MUST Action Plan 2, and so we're going to calculate her MUST score together for September using the tool on the Bapen's website. So I've Googled the Malnutrition Universal Screening Tool. The first link is a PDF, which you can download and keep, but the interactive tool is found here under the MUST calculator. So I'm opening up her website, their website. So you might find you don't know a resident's height, for example. So you'd go into the subjective criteria section, and I'm going to skip this section for now and scroll down to estimating height from ulnar length. If you don't know how to do that, there is directions here by just hovering over this information bubble. And for Jess, we would change this drop down to female and highlight she's older than 65 years. And I've measured her ulnar length, which was 26 centimeters, and that's given an estimated height of 1.65. In other circumstances, you might not know your weight for a patient. They might be bedbound or they might refuse to be weighed. So there's directions here for how to measure a resident's mid-upper arm circumference, or MUAC. That can estimate if somebody's BMI is underweight or overweight, and it gives you a picture of somebody's nutritional risk, but it won't give a really detailed MUST score. But for us, we know Jess's weight, so we're going to go to the objective measurements section of the website. Now it gives the measurements in imperial, so that's stones and pounds for weight, and height in feet and inches. But in this care home, we use metric measurements. So we're going to click these switches to switch them over. So her current weight this month in September was 52 kilos, and her height was 165 meters. Now, weight 3 to 6 months ago, we see a common misconception around this. What it doesn't mean is her oldest weight. So what was her weight 3 to 6 months ago exactly? It really means let's look at that picture, the overall picture of the last 3 to 6 months, and see what her highest weight was. So if we count back, 1, 2, 3, 4, 5, 6, we're looking from March, what was the highest weight? So actually in May, she was 56 kilos. That was her highest weight, and that gives us the accurate picture of her unintentional weight loss. So we can put that in here. Now it asks, was her weight loss planned? Well, if she didn't go on a diet, then answer yes. Acute disease effect is a picture of if someone's really unwell, but they can't eat anything, eating little to nothing for 5 days at least. Our resident has lost weight gradually due to a drop in their appetite related to illness, but they're still eating just less than normal. Acute disease effect is actually really rare in a care home, so you'll nearly always answer no for this one. And then we can click show results and we have our must score calculated for us. So her BMI is 19.1 and they've given us a BMI score of 1 for that. So if her BMI was over 20, that's a healthy weight and would score 0. If she had scored, if her BMI was between 18.5 to 20, that would give a score of 1. And a BMI of under 18.5 is very underweight, and that would score 2. And looking at the history of her weight from May, she's lost 4 kilos total, or 7.1%, which we can add into our form. So weight loss of under 5% scores 0, weight loss of 5 to 10% scores 1, and over 10% scores 2. So she's lost 7%, and the weight loss score for that is 1, and she's got an acute disease score of 0. And we add up those scores, very nice simple maths, and that's a score of 2. So this shows Jess has regained some weight, and that shows that the care plan is effective, and her must score has reduced from 4 to 2. But a must score of 2 or above is still high risk, so the care plan should be continued this month. The must action plan 2 would include enriching all her meals, fortifying her milk with milk powder, and making sure she's offered 2 nourishing drinks per day and extra snacks and puddings between meals, with regular weekly reviews of her weight. And local policy here, though it says to refer straight on to the dietitians, our local policy is we encourage care homes to implement a tailored must action plan for their resident for at least 1 month. And if they don't see improvement, then you can escalate on and refer on to your local team. But they do ask that you record a detailed food diary with evidence of that implementation of your care plan prior to referring on for getting some specialist support. So there you have it, how to calculate a must score.